This is the perfect antidote for us, and I feel and I believe that it should be implemented at every level of care. Part of substance abuse, whoever you are, oftentimes comes with an incredibly large baggage. Hey everybody, welcome back to the channel. The topic we're going to digest today, and it's not really a question, it is a question, but it came up in a discussion yesterday. Why is harm reduction the perfect antidote to opiate addiction and substance abuse in general? And opiate addiction, because it strips so much from a person, is a really stereotyped example of why this is the case. Why is substance abuse, or why is harm reduction the perfect antidote to substance abuse, and in particular heroin addiction? My name is Dr. B with Dr. B Addiction Recovery. If you are new to the channel, we discuss all things substance abuse and much more. Much of it has to do with different types of medications as well. If you are so inclined, please go ahead and click the like and subscribe button, and we would really appreciate channel memberships and Patreon accounts so we can do a lot more of these for you on a regular basis. There are some videos pending for those of you that are regular viewers. They will be coming up shortly. Let's get right into this. We don't have much time, but I really want you to consider this. Why is harm reduction the perfect antidote in our society for an approach to heroin addiction, opiate addiction, substance abuse? Let's break it down. So when I say the approach, in what context and setting am I talking about, I really want to expand this, and I'm going to say it is the correct approach in every clinical setting, okay? Whether it's medical, psychological, behavioral health, mental health, social services, and really an approach to what is currently criminal justice system, which should really change as we develop and evolve as human beings. But let's talk about harm reduction. What is harm reduction? Harm reduction, so many different definitions, so much thrown around, and nowadays, after we started our organization in our locale, the Harm Reduction Institute, Orange County, California, I see the term popping up everywhere. And I think it's oftentimes misunderstood or interpreted, limited in its scope. Let's just really it's much more of a conceptual construct and understanding versus a definition, okay? And first, the idea is a perfect example is a needle exchange clinic, and it really, in the U.S., it popped up in early 90s, late 80s, first in San Francisco area, then New York. And the whole idea was, well, these guys are going to use intravenous heroin or other drugs, and we really got to stop the spread of AIDS so they don't get HIV or AIDS. So it was directed at HIV or AIDS. So let's give them clean needles, and we are minimizing harm reduction. And these clean needles do work, and these needle exchanges do work and did really help to some extent mitigate the spread of HIV. Harm reduction. Handing out condoms, handing out Narcan is a big one where people say, hey, that's harm reduction. But I really want to give a gestalt for it, a deeper understanding. And as you go through different textbooks or papers, it's looked at differently, or even injection site or use site. Well, some of those are in Canada and other places, and they all work marvelously. If you go back in time, I used this one example at one time, 4,000 years ago in a Chinese province somewhere. A lot of guys were going to the local bar and drinking heavily. On their walk home during the winters, they would walk along the edge of the riverbank, and they would slip and fall into the bottom icy cold river. There was no water in it, and they would hit their head, break something, die in the cold. The local authorities attempted in vain to really get these folks to stop drinking or drink less at the bar. And it wasn't going anywhere. And not only is a human being's life lost that could have really done much in this world, but there is a huge impact on the family system within once something like that happens. We have to think about all of the consequences. So what did they do? They built a fence and along the edge of the river and the river bank, and that is a harm reduction approach to heavy drinking at the bar. Okay, that's harm reduction. So you see all these things: Narcan, needle exchange, condom distribution, and you try to instead of stopping the primary behavior that is toxic to you, you go to the secondary place where it pops its head up. Okay, I want to say, give a larger picture of what harm reduction is, and I'm going to call it a universal set of human right-like principles, and these really ascribe to the individual and describe autonomy, free will, agency to choose how they want to live, and lack of judgment, basically reserving judgment, autonomy, free will of agency of choice, and reservation of judgment or punishment to that individual. And those are the most universal ways I can think of what harm reduction is. This is the perfect antidote for us, and I feel and I believe that it should be implemented at every level of care and engagement for a substance abuse patient or client. And whether you're in a medical clinic or whether they are in a mental health intensive outpatient groups, social services, and criminal justice system. Let's think about why. Look, at the medical clinic level, if you're using that kind of approach, this is a population that is coming at you, looking at you with your white coat and a sterile surgical non-human clinic as a place of authority and to some extent a threat. Part of substance abuse, whoever you are, oftentimes comes with an incredibly large baggage and paranoia and concern about being judged, having to hide what they did yesterday, attempting to present a face. Okay, all of that is going to take away from the care, and all of that is actually part of the disease that needs to be addressed. Okay, so and these people, this subset of patients also has a difficult time making appointments, showing up on time, following through with things. They might be on medication-assisted treatment, but last night they did a little bit of meth. Oh my God, the urine's going to be dirty, so they're going to fire me. I got to lie. Look, harm reduction is this. As a clinician, you tell the patient, you make it known to them, I am not going to pass any judgment onto you and your lifestyle. I understand all of it, okay? And I understand your difficulties in getting to the clinic. I will make sure that I'm not going to enable you, but I'm going to empower you. I'm going to embrace you. And yes, this is at the clinical medical level. I am going to embrace you as a human being in a professional, compassionate, caring, and scientific-based way, but not enable you. I will hold you accountable. And so doing this not only will get you better outcomes, okay, because we know harm reduction works, but it's going to really create a situation for those health workers also to understand the disease entity they're working with, to understand the human beings they're working with and how this disease affects them, to know and get familiar with and be empathetic and compassionate to to not only where they're at right now in their recovery, but telling them, I'm here for you. I'm going to create my organization in a way that is flexible enough for when you feel like bullshitting, you're late, you're doing this, that, can't make it on time. Don't worry, just show up and you will get good outcomes. But there has to be good care, clinical care as well. Okay, that's at the medical level. But let's go a little bit further and spread this out. At the mental health level, at the case manager social services level, if they start to implement a harm reduction approach, and many folks in these fields already do. They're empathetic, compassionate, have a lot of sympathy for these folks as they've come from it themselves or may have family members, loved ones affected by it. But if they're not, we can try to get people to fake it till they make it and understand the difficulties that these patients will be going through as they attempt to get their lives in order, whether it's getting some housing, getting off the streets, getting into mental health facilities, and so forth. And it makes us, loosen your tie a little bit, okay? Let these people get a feel for what it is to be human. Why it's the perfect antidote in our society in particular is this. And this concept, this idea needs to be, must be at some point infused into the criminal justice system. Our views of substance abuse as crime and punishments dished out. It needs to be infused into our public policy, into our public health policy. All of these things are severely lacking at this point. Compassion, empathy, value for individual human beings. But even more horrifying, you would think the science of public policy dictates and demands evidence before decisions are made and policies implemented, and there is none. Okay, that is, it is driven by whatever our political system is and whatever our economic system is, and it's purely driven by our political economy and the needs of fulfilling the sort of monopoly money that is infused with this whole system. It's certainly not the individual. And so if we attempt, or if we start from the bottom up implementing this idea, there has to be some degree of spread within our social framework and structure, and we can hopefully potentially get to where we want to. Our institutions, both systematic and systemic, lacks a harm reduction attitude, understanding, approach, which is just basically saying that it lacks compassion. It lacks thinking in making decisions for the individuals. And so these individuals, whether they're trying to access mental health, medical care, recover from deeply embedded trauma from childhood or otherwise, apparent through physical abuse or incognito through years of emotional abuse and dysfunction. We are not recognizing this. These patients oftentimes themselves don't recognize it, and they sort of get caught up in this game. But if from the ground up we attempt to build an infrastructure, at the individual interacting level, from the healthcare worker, the mental health worker, the social case manager worker, the criminal justice system, it's got to spread. It's going to spread. It's needed. It works based on science. We cannot financially or resource-wise afford to continue in the way that we have been. Too many people are getting sick in different ways, including substance abuse, anxiety, trauma, all trauma induced from some point in their life. These things need to be addressed. Punishment should not be part of it. The surgical, transactional state that we live in needs to go away. Then we will see an incredible amount of money saved. We will see it in every area, improved outcomes in substance abuse, mental health issues, criminal justice system, and the money that is saved. And I think fundamentally people's values would change. I'm going to leave it at that. I want you to think about what I'm saying. I want you to generate discussions in the comments below. We can follow this up with a live discussion because I think this is so important from a 30,000 foot view in proceeding in our public policy, public health, and patient management that I can't stress it enough. By the way, any fan of our organizations out there and what we do, and when I started all of this, I think I'm pretty good at managing medications, understanding patients' needs, and so forth. But it is all couched in these concepts, which I'm happy to expound on more. Thank you very much. Again, don't forget liking, subscribing, generating comments below, and we can go from there. Give me some feedback. Give me some thoughts. See if what I'm saying makes sense. Have a great day, guys.